Okay, today we're going over a sample evaluation for the shoulder. And so we're often seeing clients that come into us with front of the shoulder pain, biceps tendonitis, rotator cuff injuries, and also labral type injuries. And so we're going to go over a series of tests and assessments that we use to determine a safe starting point for our clients experiencing shoulder pain. So the first thing that we're going to do is actually assess our range of motion. And range of motion is simply how the shoulder and the upper body are moving. And for certain activities, they're going to require certain levels of range of motion. And sometimes when we don't have that range of motion, this leads to injury, it leads to compensation, or in some cases it leads to more chronic type injuries that aren't going away. So we're going to go over a series of what we call table tests to look at Corey's range of motion here to see what we're working with in the upper body. And so again, this is what's called a passive test, where we're actually looking at how well Corey's shoulder can move overhead in this context. And every time we're going through a test like this, we're asking our clients where they're feeling it. And sometimes that's important because where they're feeling it lets us know what might be tight or what might be limited. So this is an example of our external range of motion. We have internal range of motion here. We have ranges of motion coming up overhead into what's called abduction, and also flexion in this range. In addition, we're also using our hands to do what's called palpation. And in this case, this is a diagnostic test where we're understanding what tissues are sensitive or irritable. And so we're actually going to go into certain muscles of the shoulder to press and give us an idea of what structures may be involved. And one thing to note is that sometimes when we have pain in a certain area, that doesn't mean that it's coming from that area. So we're actually using our hands to try and recreate the symptoms that you're experiencing, which as a clinician and physical therapist gives us an idea of where we need to actually address. So we can also roll onto the stomach, and in a similar fashion here, we can have the hand come off the side where we're feeling for the muscles of the rotator cuff and around the scapula. And very similar to the other side, we're palpating the area that might be involved, or again, sometimes pain can come from a different area that can be referred pain. Now, if Corey scoots over to the edge here, we can also test our shoulder strength. So in this case, what we might do is we might have Corey come up to a T position where I'm giving him some pressure and I'm giving him force and asking him to resist me. This gives us a good insight into how well the muscles can actually contract and create force, which again, for specific activities, will require a certain level of force that you need to create during that activity. After we've done our table assessment, we're actually going to come up overhead and look at some active movement. So all of these movements on the table were the clinician moving the client. Now we're actually going to look at how the client moves. So if we stand up overhead here, one of the first tests that we're going to look at is just standing shoulder flexion. And so we're looking at the space of his shoulders between his ears. We're also looking for any twisting that's occurring in the upper arm. If Corey faces away from us, we'll do it again from this view. Really what we're trying to understand is how well are his shoulder blades moving up and around his rib cage, as this is a very common area that becomes sticky or limited in range of motion. Another test here that we can use to assess the rotational components of the shoulder is a scratch test, where one hand is going overhead, one hand is going under the body, and generally we're looking at the space between these two hands to understand what side might be limited. In addition, we're asking him where he might feel it. It's very, very, very common for our clients to have limitations in the front of the shoulder that prevent them from reaching behind their back. And in some cases, again, we can have limitation in our shoulder flexion and external rotation on this top hand. Generally, one of the next things that we're looking at is how well we can create force in a weight-bearing position. So in this case, we'll go ahead and hop to the ground in our hands and knees. And the first thing that we're going to look at is how well the upper back and shoulder, elbow, and wrist are able to work together. So we may even cue Corey to think about pushing and reaching his shoulder blades towards my hand and then going ahead and pinching. And this shows good control of the shoulder blades, which are a really important group to make sure the shoulder is in a safe position to actually work. From there, we might actually ask him to lift up his knees, which now is going to put way more pressure on the hands. And so if we're dealing with any sort of injury or weakness in the upper body, this often shows up in a weight-bearing position. You can take a break. Now, to challenge that even more, to give us more insight of what structures might be involved, we're going to challenge this now by, instead of supporting ourselves on two hands, we'll go to one hand. So knees come up, and we'll ask them to take one shoulder or one hand and touch the other shoulder. Again, this gives us really good insight in how well the shoulder blade and shoulder are working together to create force and resist any movement. Now, all this is good, but now we're going to progress to what's called open chain movement to see how well the shoulder can create force in the upper body. So we'll head on over to this band, and this is an assessment for the rotator cuff, or the muscles on the back and the side of the shoulder. And so we'll do a band series here, which again, Corey holding the band in this position, he's resisting his hand moving into what's called internal rotation. So this is an isometric contraction of his rotator cuffs. As he presses out, the further an object is away from the body, the more stress will increase in that shoulder region. And so we'll have Corey do a few different exercises here, some circles and also some pulls across the body, again, which will compare side to side while asking him, what do you actually feel during some of these movements? When clients do have pain performing some of the movements, it doesn't mean that the movement is bad, but the movement might need to be modified to meet them where they're at their level of injury. A very similar exercise that we'll use is actually with a dumbbell that we'll use to, again, assess our force production capabilities and also capacity. It's not uncommon that when you have a shoulder injury, you may be able to do 1, 2, 3 reps, but now when you're starting approaching 10 reps of an exercise, weakness and fatigue start to settle in. That gives us an idea that we actually have to work on strength in that injured area. So we're going to do a press out in this case, where again, gravity is pushing down on Corey's shoulder, and he has to use his musculature to actually resist gravity and to keep his arm moving in a straight line. The two other exercises that we'll do, we'll go to the ceiling and pull it across our body, which really stretches and stresses the outside and back of the shoulder, which will generally be the rotator cuffs of the shoulder. And lastly, this is called a haymaker, again, where Corey's bringing that arm up overhead, challenging the muscles of the shoulder a little bit more intensely. And all throughout this process, we're checking with our client, asking them how it feels, where they're feeling it, the level of effort that they're applying, and we're also going to test this side to side. When we see big differences between the right and left side, it lets us know that we have to spend more time on that affected side building strength to make sure that we recover from injury.